नमस्ते। इस इंटरैक्टिव सेशन के लिए आप सबका हार्दिक स्वागत। So myself Dr. Pratibha. Let us start the session. So today is almost 15th day, right? 15th day of the course. So we have 5 more days left, right? Okay, let us start with today's class. I have received some questions, so I thought let me answer those questions, and in the meanwhile, if time permits, definitely we will have a interaction directly. Yes. So when I see the query form, my video will be off. Give me just 1 minute. So the first question that I have received, let me just answer that, by Dr. Manoj Kumar Gupta. Okay. So he says, I have confusion about curd. आयुर्वेद में कहा गया है कि दही गर्मी में नहीं, सर्दी में उसे यूज करना चाहिए, लेकिन लोग गर्मी में ज्यादा यूज करते हैं, सर्दी में बहुत कम। क्या लोगों का कर्ड को समर में यूज करना गलत है? इससे कुछ नुकसान होता हुआ तो नहीं दिखता। गर्मी में कर्ड यूज करने से फायदा ही दिखता है। सो yes, let us just try to understand in what perspective this has been told. Basically सब लोग मानते हैं कि दही कुछ कोल्ड है. Yes, of course it is कफकरा, at the same time पित्तकरा also. कफ पित्तकरा, देखिए दूध is actually said to be cold in potency, शीतवीर्य, लेकिन curd which undergoes a sort of fermentation process that becomes a little bit hot in potency. So कोई भी प्रॉब्लम नहीं है तो हमें ये उष्ण द्रव्य को लेने से कोई भी मेजर प्रॉब्लम नहीं होगा. You might have seen only people who are not having any pitta related problems too much and bleeding disorders. लेकिन please try to understand that whatever you know, only that much is not the world. Basically, these qualities have been told thousands and thousands of years ago, and they're all time tested, and the concepts are accepted by all. So probably you don't come to a conclusion saying that you are not finding anything ill effects by consuming the curds during hot season. But actually, basically speaking, कर्ड्स को ज्यादा गर्मी ऐसे कंडीशन में लेने से bleeding disorders would increase, okay, especially acidity, and then all pitta related problems would increase. But since you don't know the actual qualities of the curd, you don't even realize that this problem is happening because of curds. For example, myself, I was very much curd lover when I was a very small kid. And seasonally and very frequently, I used to have this eye related problems like conjunctivitis. You might have heard about that. So at that time, we never realized that it is because of curds, because curd का एक बहुत important सा गुण है अभिष्यंदकरा. That means it blocks the channels, increases secretions in the body. At the same time, kanthe kafam karoti is one very basic guna, that is quality of curd. Okay, when we try to analyze this, वो curd को ज्यादा लेने से there are all chances that we become prone for diabetes, and then vulvovaginal infections and infections and inflammations of genitals and many other abscess, या pus, so many other unwanted skin eruptions and all such things. ये सब के लिए curd is said to be directly the karan. Okay, so you might not have known all this, but try to understand that these are some of the qualities of curd that have been told. Of course, I agree that curd is a very good probiotic. We are all curd lovers at home. लेकिन दही लेने का कुछ विधान है. अगर हम इसे अच्छी तरह से फॉलो करते हैं तो we are definitely safe. That won't cause so much of problem. In Ayurveda, it is told that ये प्रमेह का कारण reasons or causative factors of this madhumeha. इसके लिए curd is the direct cause, and the shloka goes like this. Give me just a minute. आस्या सुखम स्वप्न सुखम दधीनी ग्राम्योदक आनूप रसाह पयांसी नवान्नपानम गुडवैकृतं च प्रमेह हेतु कफकृच्च सर्वम. सो कफकरा एंड पित्तकरा इज सेड टू बी कर्ड. देखिए, आस्या सुखा का मतलब है आसन सुखा, दैट मीन्स हैविंग अ वेरी नाइस सीट एंड सिटिंग ऑन इट ऑल डे. ओके. स्वप्न सुखम, स्लीपिंग ड्यूरिंग डे टाइम. Dadhini, see, देखिए dahi is said to be the prime cause for diabetes. And Gramyaudakanupar rasaha payamsi, and many meats belonging to different regions, especially the aquatic ones and the meat of animals which generally thrive well in Anupadesha. Anupadesha, I hope you all know. Pradesh, this part explain karne ke samay, I have told you what is this Anupa. And then Navannapanam Gudavaikritam cha. Newly harvested cereals are said to be, if we are continuously using that newly harvested cereals, we are prone to diabetes. Navannapanam Gudavaikritam cha. Also then, jaggery ka kuch preparations. ये सब खाने से प्रमेह हो सकता है. That is one thing. Second thing, those who are suffering from bleeding problems and pus, infection, inflammation in the body, when they consume this curds, इनके लिए ये internal bleeding भी ज्यादा हो सकता है, and this ladies में hyper menstruation we say, in such conditions also it increases the problem. We only think of curds being cold. That is not the only guna of curd. It has a broad spectrum of actions. Okay, saying this, let me just move on to the next question. Chandrabhan Pandey is asking how to detox our body properly. Yes, there is a specific vidhan, like how we can detox your body. Like for example, detoxification या cleansing can happen in many ways. As I always keep telling you, there are basically two types of impurities of the body. First category is water soluble impurities, and second category is fat soluble impurities. वाटर सॉल्युबल इम्प्यूरिटीज तो ज्यादा पानी पीने से कम हो जाता है, लेकिन ये फैट सॉल्युबल इम्प्यूरिटीज को बाहर निकालने के लिए there is a specific way, specific vidhan which can be adopted, and the panchakarma, that is the 5 purificatory measures of Ayurveda, play a major role in eliminating the toxins. So ye detox is a very good and most preferred than any other sort of juices and other types of detox procedures. So now let us talk about some of the panchakarma procedures. I have talked about Vamana and Virechana. Now it is the time for me to talk about Basti. Basti ya Vasti. Ba, Va, both are same in this context. Vasti ya Basti is medicated enema, basically. So why the name Basti is because Vasati, that which stays for some time inside the body, is said to be Basti. There are different roots, and basically here we are talking about the anorectal root. So the detox type of anorectal root enema. So basically there are many types of Basti told in just a minute. I'll just take a 30 seconds break. Okay, so yeah, basti I was talking about. There are different types. So based on the time duration, it is of three types as yoga basti, kala basti, and karma basti. Yoga basti का मतलब है 7 days procedure, 7 to 8 days duration वाला बस्ती, जहां पर एक दिन I mean it is alternatingly two types again. So the mode of administration is same, but what we give बस्ती में, बस्ती के रूप में क्या देते हैं, that is different. For example, अगर हम medicated oils या medicated ghees दे रहे हैं, so it will be of less quantity and that is called as अनुवासना बस्ती. Okay, and दूसरे दिन हम कषाय बस्ती देते हैं and that is in a huge quantity, and that quantity basti is generally given as a part of cleansing. So ये तो evacuative basti बोलते हैं. The first one what I told you is retention basti. अगर ये हमारे शरीर के अंदर ज्यादा देर तक रहता है, so the actions are great. लेकिन दूसरा that is निरोह बस्ती या कषाय बस्ती, what I told you, it just comes out, it is expelled out of the body after 15 to 20 minutes, or we can wait up to 40 minutes after giving this basti. So this is number 2. Number 3, third din mein again it is anuvasana basti. Fourth din mein again it is niruha basti. Fifth din anuvasana, sixth din niruha, and seventh and eighth days of basti are generally same anuvasana only. Okay, so you might be thinking, what is the use of giving this? See, in modern you might have heard of soap water enema या फिर lukewarm water enema, all these. लेकिन यहाँ पर जो भी हम बात कर रहे हैं, that is a much different angle से हमें इसे understand करना होगा. You all remember second day of this course I have told you, वात का मूल स्थान है पक्वाशय. That means large intestine is the main seat. वात दोष ने पक्वाशय में, that is large intestine में अपना घर बनाया है हमारे शरीर में. I have told you this, but it also moves here and there. That means its friends places are nearby. The calf muscles, the thighs, and all these are different other places. लेकिन वात दोष का मूल स्थान है हमारा large intestine. So large intestine को cleanse करने के लिए या फिर वात दोष को कंट्रोल में रखने के लिए हमें बस्ती बहुत जरूरत है, राइट? सो डिफरेंट मोड्स ऑफ एडमिनिस्ट्रेशन, डिफरेंट डिपेंडिंग अपॉन द कंडीशन, कौन सा प्रॉब्लम है ये समझ के हम अलग अलग तरीके से अलग अलग द्रव्यों से बस्ती देते हैं. वी ऑल्सो गिव बस्ती फॉर ओबेसिटी, वी ऑल्सो गिव बस्ती फॉर वाटर रिलेटेड प्रॉब्लम्स, we also give basti for degenerative problems, pains and other things. Basti is also given in thyroid problems. It is also given in PCOD like problems. So there are many conditions जहाँ पर हम बस्ती देते हैं, लेकिन the medicines that we use will be different. Right now we are treating a case of endometriosis with basti with very good results, right? So female infertility में reproductive organs के कुछ anomalies में हम तो regularly basti देते हैं, right? So this is regarding basti. Sir was asking regarding different detox procedures. So third one is basti. Fourth one, as I told you, it is nasya. नासा ही शिरसो द्वारम. हम मानते हैं कि हमारा नाक जो है that is a entry into our shiras. So जो भी शिर रोग है, anything, any problem related to our brain or our head related region, we can tackle it through nasya. So how, what is this nasya? I have told you at the time of Dinacharya Adhyaya, I have told you that there is a concept called as what is that? प्रतिमर्श नस्य, प्रतिदिन प्रतिमर्श. क्या है इसका मतलब? प्रतिमर्श का मतलब है लिटिल क्वांटिटी में, ओके, कुछ मेडिकेटेड ऑयल्स या घीस को नाक के अंदर डालना, and you have to sit back like this, but please get this experience under a trained Ayurvedic physician. So you have to sit, put drops, inhale strongly so that it comes to your throat. Once it comes to the throat, it has to be spit out. So that region from the point of inhalation till the how it comes out, that specific region में हमारा medicine which stays there for some time does all the action. So नस्य एक ऐसा procedure है जिससे हमें local effects भी मिलते हैं and also सार्वदैहिक, that is all over effects भी मिलते हैं जिससे. Okay, so you might ask me for which all causes या फिर which all conditions में हम नस्य का administer करते हैं. First is nasya is administered for local effects, like if there is any sinusitis or continuously sneezing and chronic cold, bronchitis, ऐसे conditions में भी हम नस्य करते हैं. It is of two types. One is shodhana, that is cleansing type of nasya, and also brahmana. So nasya देने से हमारे neck के ऊपर जो भी organs है, all these would become very strong. Okay, it helps in strengthening all the organs above the neck region, and this is the local effect. Second very important effect is it has a very efficacious action on the pituitary. You know what is pituitary? Pituitary is an endocrine gland which is considered as master of all glands. So it is related with hormone secretion and controlling of other glands. अगर स्त्री के शरीर में या फिर any reproductive organ के related कुछ hormonal imbalance है, तो we tackle it through nasya also. So this is regarding nasya. Fourth panchakarma. Next is fifth panchakarma. Panchakarma number 5, that is rakta mokshana. क्या है रक्त मोक्षणा? It is nothing but bloodletting. कुछ दूषित रक्त को हम शरीर से बाहर निकालते हैं, and that is called as rakta mokshana. So it is adaptable in many conditions like skin issues, कुछ pus, कुछ alopecia areata, fungal infections, या फिर varicose veins, eczema, many such conditions में we adopt this bloodletting therapy. Okay, so this bloodletting therapy, rakta mokshan, is said to be one sort of cleansing procedure. See, all these have to be managed by only a regular Ayurvedic, practitioner. Okay, registered Ayurvedic medical practitioner से अगर आप ये सब करवाते हैं, so you can have the maximum benefits. So just like how we service you get the service done for our vehicle, ऐसे ही at least साल में एक बार ये detox therapies को please experience this. See, all these have to be experienced. It cannot be explained, better experienced. So many, see, we Ayurvedic doctors generally once or twice a year we undergo this detox procedure, but the decisions have to be taken only by a Ayurvedic doctor. क्योंकि it is not that क्या हम घर में रक्त मोक्षण कर सकते हैं, क्या घर में विरेचन वमन, no, it is not like that. It is a specialty branch of Ayurveda. ये 3 years का specialty course है. After 5.5 years of doing this doctorship, 3 years का specialty course भी करना है, जिससे आप बन सकते हैं the specialist of Panchakarma. लेकिन it is not so simple that we can adopt this sitting at home. Not just recipes or not just some oil massages. It is not just that. Okay. So this is about different detox procedures. Let me see further questions. हाँ, कर्ड के बारे में, yes, we have discussed, and then as we have told, who has asked this? Dr. Abha has asked. As we have told that we consume anything when previous meal has been digested. What about snacking options or tea? Should we take them or not? See, very strictly speaking, we are not for tea consumption. We are against. Lekin, you can just make it healthy. See, how we can analyze this is main meals, 3 या 2 प्रिंसिपल मील्स को अडॉप्ट कीजिए, और 2 प्रिंसिपल्स मील के बीच का जो टाइम है उस समय either have only liquids or something that is raw. Okay, so that is a better option. See, if you are having 2 dosas at 8 o'clock, at 10 o'clock if you are having chapatis, at again 12 o'clock if you are having some milk, and again 2 o'clock lunch, no, we don't advise this. We advise 3 principal meals, या फिर 2 principal meals is optionable for only those who practice this intermittent fasting. लेकिन ये eating time, first thing what we would like to say is let your dinner be early. So dinner early करना चाहिए, और in between 2 meals you can have either liquids or just the salads in between. Okay, so try to make your meal as nutritious as possible, in the sense you can have definitely ghee, you can definitely have paneer, you can have a whole lot of vegetables, all these. लेकिन 2 meals के बीच में please keep it very simple, like fruits or dry fruits or something like that, or anything that is liquid with very less or no sugar. So that would be fine. I think you can have a very good diet plan with this, like 3 principal meals and beach mein kuch salads or fruits. It comes under the principles of Ayurveda as well as modern nutrition, right? Okay, so 3 meals per day means 3 principal meals. इसके बीच में कुछ easily digestible snacking definitely you can have, like protein bars or anything, no problem at all. Absolutely. Let us see what more questions we have. Can we skip dinner? Any side effect? Naina has asked, rather than skipping dinner, you can make it early, like 6:30. That's better. It's not so good to skip dinner because your body has to prepare for the fast, right? So it's not so good to skip dinner. You have something, keep it very light and keep it very simple. Okay, and keep it early. Durga Kumari is asking me, how much quantity of bitter gourd juice per day can be given to diabetic patient? No, actually bitter gourd juice has to be given in very little quantity, and that too only in obese and overnourished diabetes जैसे condition में ही सिर्फ दे सकते हैं, not for everyone. Now it is a trend that many of the diabetics, they just go for something that is very bitter. It is not like if you're consuming bitter, your sugar levels comes down. So bitter gourd can be consumed as a vegetable and not necessarily to have bitter gourd juice every day in the morning. क्योंकि ये bitter gourd, it is very bitter, as you all know. ज्यादा bitter लेने से शरीर में वात दोष प्रकोपित हो जाते हैं, and we will land up with too much of dryness and vata related problems in the body. इसलिए please try to reduce the quantity of bitterness. If you are diabetic, you can have something that is bland rather than going for bitter. And bitter gourd को आप vegetable जैसे भी use कर सकते हैं. And also remember, no fresh juice like bitter gourd and all should be consumed more than 30 ml. Okay, right. Then Bharati is asking, fruits don't mix with milk, but so many fruit juice shop, apple juice, banana juice, papaya juice, every time milk, mix milk, any harmful to? Yes, definitely. That is what we are trying to tell you. Please do not consume fresh fruit milkshake. Better go for fresh fruit juice or have milk separately. Do not combine fresh fruit with milk. So that is the worst thing that we can do to our body. Do not combine milk with fruits. Okay. So definitely people who are very much addicted to this fresh fruit milkshake and all, at some point of time or the other, they may land up with problems which are due to viruddhahar, and they don't even realize that it is because of that. As I told you, I was very much addicted to the curds, and I never realized that it was because of too much of consumption of curds that as I was suffering from this eye related issue. And also हम तो बहुत ज्यादा देख सकते हैं कुछ young mothers, they are feeding curd rice to their children every day at night, that too late night, and continuously they come and complain of this regular running nose and cough and all these. See, it is not mandatory that everyone should have this knowledge. So at least when someone whom you go for consultation, whom you consider as specific subject specialist, if they are telling, you should have an open mind to listen and understand and adopt, isn't it? So for so many children, we have asked the mom to stop taking curds at night with great results. Okay, see, आयुर्वेद का मूल उद्देश्य है आरोग्यवंत व्यक्ति का आरोग्य संरक्षण करना एंड व्याधित व्यक्ति का चिकित्सा करके व्याधि को दूर करना, isn't it? So in that case, if चिकित्सा में पहला सूत्र है निदान परिवर्जन, that means staying away from the cause. When you don't know the cause and when someone is telling you this is the cause of your problem, we should have an open mind to accept it, isn't it? It is not a cock and bull story. It is not me who is telling. It is not somebody of our experience or somebody of our age telling. No, it has been told that so many, I mean, years, centuries and centuries ago, that milk plus fruit is not a good combination. Instead, you can go for coconut milk with fruits, yeah, fruits with honey, like that. Better have milk with dry fruits or nothing at all as it is. So that is the best way of consuming fruits and consuming milk, right? So saying this, see, I have received only these many questions on the query form. I would expect more questions in the next week. Next week being the last week, I would expect more questions. So let me just move further answering the messages. So yes, let us start. Beena Menon has asked, Sikatu churna has to be consumed before or after food. Better if it is consumed after food, क्योंकि ये बहुत स्पाइसी रहता है, इसके वजह से गैस्ट्रिक इरिटेशन भी हो सकता है. But have this Trikatu churna in very little quantity and with proper anupan. Effective way to get rid of constipation. Again, Beena Menon is asking, have a good amount of fiber, number one. Number two is you should consume something that is lubricating for the system. Number three is you must do a good amount of exercise. Number four is have good quantity of fluids. So when you are doing all these, definitely there will be some changes in your body. So it is common that कुछ लोगों का ऐसा tendency होता है constipate होना. So in such conditions, this is actually very good. So how to deal with irregular periods, 21-year-old girl? So irregular periods, maybe you're talking about delayed periods and all. So it is very common that girls of a very young age nowadays, they are suffering from such period related issues. So what can be done is properly following dinacharya, properly following rutucharya and all these. So that is most important. So that dinacharya ka adopt karna bahut important hai, and also following rutucharya, doing proper vyayama, that is exercise, and consuming nutritious food. Nutritious in the sense it should be a balanced meal in all terms, like fiber, fruit, vitamins, minerals, carbohydrates, everything, with good lot of exercise. And sedentary habits और sedentary lifestyle को avoid करना बहुत जरूरी है. ये सब करने के बाद अगर periods irregular ही है, so just think of weight reduction, because sometimes this obesity might be one of the main causes. If again weight is not an issue, You can consult our Ayurvedic doctor. We have specialists in our team. And also, generally, if you want me to say, I would suggest some combination of Ashoka Rishta and Kumariya Sava for your girl. Okay, so that can be consumed. And stomach region को, lower abdomen को ज़्यादा आप massage कीजिए, and that should be fine. Massage with till oil regularly, and then internal consumption of Shatavari Kalpa regularly. All these together would give you good result, right? But you have to take action very soon, क्योंकि इसे हम ज्यादा होने के लिए नहीं देना चाहिए. It might turn to PCOD and all, so be very careful. Then raw salad with food 3 times in a day is good or not? Do not consume too much of raw food also. Once or twice a day is okay. All the 3 meals, it is not good. I'm a diabetic patient, so I'm taking salad with breakfast, lunch, dinner. Make it 2 times. Okay, Swagatika Purohit, you can make it 2 times. Hema Madhwani is asking, which method of Panchakarma is good for diabetics and heart patients? आपको तो विरेचन या बस्ती अच्छा होगा. Please consult Ayurvedic, registered Ayurvedic medical practitioner, क्योंकि only a person who sees the nadi and who directly consults the patient will be a better judge in this case. Swagatika is asking, normal salt or Himalayan pink salt good for thyroid patient? See, again, it depends. It is not only about salt. Hypothyroidism तो बहुत सारे कारणों की वजह से हो सकता है. So all that have to be elicited properly. Vishnu Priya is asking, I have heard that mango milkshake is not harmful like milkshakes of other fruits. Is that true? No, actually it depends. Milk can be mixed with this mango only in condition where if if mangoes are ripe, only ripe mango fruits can be consumed with milk. So the fruit has to be very sweet. अगर थोड़ा सा भी अम्ल रस, that is sourness है, तो वो अच्छा नहीं है. So इसलिए be very careful while consuming milkshakes. Better to avoid milkshakes. And आजकल तो there is again another very big case that most of the people are, the vendors, fruit vendors, they are mixing some acidic substances with the fruits so that they ripen very soon. So ये तो acid अगर milk के साथ react होता है, again it is not a good thing. So always remember, better not to consume fruits and milk together. Chandrika is asking, salad before meal or with meal? It depends again on the condition. Before meal, अगर आप salad consume कर रहे हैं, you won't feel hungry at all. Your stomach will be full very soon, isn't it? So you won't get all the proper nourishment. अगर आप obese ho and if you are trying to go on a calorie deficit diet, you can have salads before meals, of course, yes. If you are snacking regularly in between, you can have this. अगर आप सिर्फ 2 या 3 मील के लिए stick हो रहे हैं, then definitely it's not a good choice. Dr. Abha is asking, the ripe papaya shake can also be consumed? No, that is what I'm telling you. No fruits with milk. Swagatika is asking, thyroid patients can consume millets or not? Why not? Thyroid patients can definitely consume millets. Pregnant women take salad. That is what I'm telling you. There should be some mindfulness and there should be proper thinking before, proper justification, proper strategy should be there before going for this. Okay, this diet plan and all. इसलिए अभी आप diet plan मत कीजिए. You please wait for some time. You take up further advanced courses also before you go for planning a diet. So it is not that this is totally not good. This is totally not bad. It is nothing like that. You have to be very sensible in choosing. So कौन सा कहाँ यूज करना है आपको अच्छी तरह से पता लगाना चाहिए. So that is very important. And then let me just see more questions. Time difference between fruits and salad before lunch. There is nothing like that. Fruits and salad. I mean, you're asking before having meals, how much time should be there after consumption of fruits and salad, isn't it? So that is what I told you. If you are on a nutrition deficit diet या फिर आप obese हो, थोड़ा सा weight कम करना है, calorie deficit diet में जा रहे हो, या फिर आयुर्वेद में बोलते हैं अपतर्पण चिकित्सा, that means nourishment reduction. So ऐसे condition में definitely you can have fruits before, just before food also, or you can wait for some time also. There is no hard and fast rule over here. Okay. Yes. Anything else? Questions done. Ekta Gupta is asking, it's good to take chas over curd. Yeah, it depends. Again, chas is not so very much abhishandi. As I told you, it does not block the channels and it would not increase the secretions. Lekin that is regarding chas. Kyunki it is diluted, isn't it? Just think of how the curds are prepared. So how it is like we warm the milk, इसके बाद थोड़ा सा some amla dravya, that means sour curds or anything is added, and we close the lid and wait for a particular duration of time before it becomes curd, isn't it? यहाँ पर तो anaerobic fermentation हो जाता है and the exact and entire quality of milk is changed. So though we can say both are good sources of calcium, it is that we are not thinking, I mean, we are not up to only, I mean, we are not behind only calcium source, isn't it? So there are other properties also of curd. So curd, if you are finding, see, we have analyzed our prakriti on probably second or third day of the course, isn't it? So kapha prakriti walon ke liye ya pitta prakriti walon ke liye regular consumption of curd every day at night is not a good idea. Okay, so ऐसे condition में you can go for chas. Again, for people who are of vata prakriti, definitely curd can be consumed, but not at night. So this is the hard and fast rule. As I have told you, I think you have all purchased this hard copy of Bhav Prakash Nigantu या फिर PDF है आपके पास. You can just go in detail about Dadhi Varga. Okay, or you can go for this Easy Ayurveda website. I have told you many times. So Easy Ayurveda website में आपको बहुत सारे information मिलता है regarding curds. Please go through that. So it's mandatory that we need to understand the properties, qualities, therapeutic utility. Definitely it's a very good probiotic as I have told you. लेकिन सोच समझ के जानबूझ के use करना है. Taking curd has helped me improve my gut issues, but I avoid during menstruation. Is that okay? Yes, definitely okay. Ekta Gupta. And then for Pitta dosha, what Panchakarma is normally prescribed? I have reflex at night. So this shows that you are having some gastric issues. Please try to rectify that. और इसके बाद आपको विरेचना treatment would be very good. Sugandha. Then Hema Madhwani is asking, milk, curd, buttermilk, which is good for gout patients? See, anything in moderation is okay. Not only for gout patients, anyone for that matter. Gayatri Vasanta is asking, ma'am, skin allergy ke liye which kashay we use at our home? Please tell me. So I need more details regarding this, Gayatri Vasanta. So what kind of skin allergy do you have? Like, are you suffering from hives, or is it some simple rashes, या फिर कुछ abscess or some pustules? I want to know more about it. Write to us in detail. Dr. Abha is asking, I have seen a kapha patient closely suffering from asthma, but she is not diabetic, 70 years age. What is the reason? Doctor, I think you need not ask me what is the reason for asthma. Yourself being a doctor, Kapha Prakriti people are more prone for asthma. It's not mandatory that sirf diabetic is kapha related problems. So 70 years age, what is the reason of asthma? You need not ask me yourself being a doctor, isn't it? Hmm? So it might be hereditary, or it might be because of a wrong lifestyle, wrong choices, anything, isn't it? Okay. I was asking about diabetic. What is that? I did not understand, Dr. Abha. Hmm? Then I have answered all the questions that I have received. I need more details regarding some of the issues, health issues, like Gayatri Vasanta's question and Dr. Abha's. It's not mandatory to have diabetes. Asthma patients, it's not mandatory that they have diabetes. Kapha Prakriti and diabetic. I don't understand the logic, what you are asking. Kapha Prakriti and diabetic. What is that? See, diabetics need not be only Kapha Prakriti people always. In diabetes, there are many other types also. Okay, we have Vataja Prameha, Pittaja Prameha, Kaphaja Prameha. So, this diabetes problem के लिए सिर्फ कफ प्रकृति होना या फिर कफ कर आहार विहार लेना सिर्फ यही मैंडेटरी तो नहीं है. ओके, राइट. Then anything else? Ekta Gupta is asking, ma'am, like ripe mango and milk can be combined as can be ripe banana and milk. No, no, no. Bananas are not at all allowed with milk. Not at all. Okay. Gayatri Vasanta is asking, normal skin allergy, itching only nights. See, you may say it is normal, but dermatology is a separate branch by itself. If you simply ask me, skin allergy ke liye kya lena hai, it's a very vague thing, very difficult to answer. Okay, so itching only nights. See, all the skin related conditions, they all get triggered at night itself. Kyunki night region, and I mean night time mein hi most of the microorganisms they exhibit or they show their presence. So in skin problems, it's always that there is involvement of microorganisms which are very active at night. So generally, if you are asking me skin allergy ke liye, some bitter vegetables are good. Like it can be many of the gourds. It can be bitter gourd, karela, I mean ash gourd, bottle gourd, ivy gourd. Any of these gourds are very good for normal skin allergy. And kashayams which are readily available. See, most of the ingredients of some kashayams may not be available at different places. Okay, in all places. इसके लिए आपको prepared kashayams लेना अच्छा होगा. Like for example, Patoladi Kashayam, Aragvadhadi Kashayam, all these ready ones. Okay. Bina Menon, you will have to take up advanced course if you want diet chart and all for kapha, vata, pitta doshas. क्योंकि आप सबको ये दोषों के बारे में complete परिकल्पना has not come. So we are teaching in advanced courses different types of different doshas. As I generally keep on telling you, vata dosha is of 5 types. If you are a puja oriented person, you will understand. They say pranaya swaha, udanaya swaha, samanaya swaha, all these, no? So the 5 types of vayu are pranavata, samanavata, udanavata, vyanavata, and apanavata. So different physiological actions of all these different types of vata, and similarly there are 5 types of pitta and 5 types of kapha, which are present in everybody, I mean in every individual. Okay, so her dosh, subtype of dosh ka kuch specific customized and designated job bhi hai, and that you need to understand before going in for planning a diet. Right. Next, let me just see what question I have. Curds with fruits also not good. No, Ekta Gupta, this dairy products के साथ be it curd or buttermilk or anything, fruits के साथ लेना अच्छा नहीं है. Dr. Abha is asking, should we restrict curd for pre-diabetic? It's better if you do so, Dr. Abha. Yes. Any more questions? हाँ, Rakhi is asking, dry eczema and itching में क्या नहीं खाना चाहिए? So yes, this is again a very a question which requires a broad spectrum of answers. For example, ये dry eczema जैसे conditions में we consider it as because of rakta dushti. So rakta dushti का मतलब है, you all know that rakta is one of the doshas, sorry, dhatus. Of course, some authors consider rakta as dosha also. रक्त दुष्टि जैसे कंडीशंस में मेनली आपको पित्त इन्वॉल्वमेंट होगा. ओके, सो पित्त दोष एंड रक्त धातु आर वेरी क्लोजली रिलेटेड. सो पित्त ज्यादा होने वाले जैसे फूड आर्टिकल्स को आपको कंज्यूम करना मना होगा. लाइक फॉर एग्जांपल स्वीट, सॉरी, hot and spicy things, very sour things, and such fried ones, sprouts, all these have to be stopped, avoided in conditions of any skin problem for that matter. Okay, आपका digestive system very clean and clear होना चाहिए, क्योंकि sometimes what happens because of अग्नि की कमी होने से हमारे शरीर में आम नाम का एक unwanted undigested food substance that starts accumulating, जिसके वजह से many problems would arise. अगर ये आम का lodgement हमारे skin में हो जाए तो we would suffer from skin issues, right? So इसलिए आम नहीं होने देना चाहिए. इसका मतलब है you must consume food that is very easy for digestion and which would help in digestion. And see, dry eczema के लिए कुछ और भी आपको कंज्यूम करना है. Like for example, महातिक्तक घृता, some ghee preparations are actually very good. Okay, right. Ekta Gupta is asking, curd can be included in arthritis? Yes, it can be, लेकिन रात को नहीं, आफ्टरनून मील के साथ ले सकते हैं. Beena Menon is asking, can nasya be done at night before bedtime or only in the morning? Yes, there are 13 kalas that have been told for nasya. So any of those can be adopted. Hema Madhwani is asking, vegetable raita is good for health, including onion, tomato. Yes, definitely it's good. Preeti is asking, sprouts are not good for which doshas? Specifically Vata dosha, लेकिन general agni दुष्टि, I mean agni related issues के लिए sprouts तो अच्छा नहीं है. Nayana is asking, what type of food we have to avoid in lichen planus? देखिए, lichen planus एक ऐसा skin condition है which is generally we consider this as autoimmune. Okay, lichen planus में all the panchakarmas have to be adopted for proper cleansing. So cleansing of the body is very important in lichen planus, and regularly we will have to follow certain healthy diet and principles, daily regimen, dinacharya, rutucharya, all these are very important. And इसके साथ कुछ rasayanas are very good. If you just ask me, I would suggest this madhusnuhi rasayana, amrita bhalataka rasayana, all these. See, not that all diseases are curable only with food. So diseases से हम I mean diet, proper diet लेने से हम diseases को manage कर सकते हैं. It is not there is one or two cures. Some जीरा का कषाय बना के ले लो, ये problem totally बंद हो जाएगा. No, lichen planus is not a very simple thing. It's a very complex disease involving, I mean, autoimmune. It's an autoimmune disease, right? Then, so lichen planus में basically again paneer and such preparations, non-veg food, all these have to be avoided. And then Ekta Gupta is asking me, who should avoid milk and milk products in skin issues? So it's that milk and milk products, kapha related people who are having kapha type of skin problems, they should avoid milk and milk products. Oh, I got a call in. Sorry. Forget. Then what are the good sources for B12? As you all know, B12 is available only in animal products. So for vegetarians, it is, of course, I would say dairy products. And then, as I told you, this red rice, which is red raw rice, which contains a lot of anthocyanin. So unpolished red rice is a very good source of vitamins. Also, milk products, dairy products, ghee, all these are very good. Yes, I have answered almost all questions. When in a family, Preeti is asking me, when in a family, we have people just, then how to plan diet? Practically not possible to cook so many varieties. How do you manage such situations? See, it is not, that is why we ask you to adopt a healthy diet. It is not possible to prepare different varieties of food for different people, isn't it, at home? So better you all adopt the same diet, which is very healthy, which we have told. Shashtikan Shalimudgan Saindhavamalakayavan Antarikshapayasarpihi Jangalaihi Madhuchabdyasit. So a very good plan you will have to adopt. So Hitahar is the basic concept that we would advise. I will talk more about this in the coming week. Don't worry. Then it is practically possible. If you have a proper mindset, it is definitely possible. Skin problems में sprouts को boil करके, हाँ, this is what you have asked, Rakhi. दिया जा सकता है, and fiber food and gluten free atta is good. Yes, that can be done. Yes. So today we had a nice interactive session. So many questions I got, but I would expect more questions in query form. Okay. So in query form, I hardly see some 9 to 10 questions, but here in the chat box, so many questions. Why don't you fill the query form? Okay. So next week, I would expect more questions. Right. Myself, Dr. Pratibha, signing off. All of you, please go through the slides, ask questions, make notes. All the best for MCQs. Oh, I hope it's done already, right? Okay. We'll meet you all on Monday with a new topic. Okay. Thank you so much. Bye-bye.